Hi, this is David Villar. I teach pharmacology in a veterinary school in the country of Colombia. Welcome to this presentation. We are going to talk about the different routes of administration, which, as you may have already guessed, is the means by which the drug is given to a patient. And I will start by saying that the three components of therapeutic administration of drugs are the dose, the interval, and the route of administration. As you can see, the route of administration is the third component of the dosage information in any prescription. And it could happen that even if we use the correct dose at the right interval, the amount of drug that reaches a target tissue in the body can be totally changed if we use an inappropriate route of administration. We could say that we use the different characteristics of the route of administration to provide the appropriate amount of drug to the correct part of the body. Routes of administration can be classified by where the drug is being placed. We can use enteric or parenteral routes to deliver the drug to the systemic circulation and have it distributed throughout the body that way. Or we can use routes that will only deliver the drug to a specific or local site in the body. Parenteral translates to beside, beyond, or apart from the intestines, and it basically refers to the space between the intestinal tract and the surface of the skin. As you can see, drugs given by injection are said to be parenterally administered. However, you can also use inhalation and route to have drugs like the general anesthetics being delivered to the body. And some drugs can also be delivered transdermally if they can cross the skin easily. And I'm thinking of the opioid fentanyl that is delivered either in patches or in a solution that just came out on the market, which allows penetration through the skin. Drugs can also be delivered systemically by administration through the GI tract, and this is referred to as enteral. And this includes the oral through the mouth, the buccal between the cheek and gums. And in humans, the drug is usually placed underneath the tongue, so it's called sublingual. And finally, we have the rectal, in which the drug is placed directly into the rectum. When the drug is absorbed directly in the mouth or the rectum, it has the advantages of usually being faster than when we give it orally. And it also bypasses the liver, which results in greater bioavailability. When we don't want the drug to reach every organ system in the body and only a specific site, we might be able to use routes for which that particular drug will be poorly absorbed. Obviously, the advantages is that you lower the risk of side effects by only delivering the drug to where it's needed. For example, when we use antiseptics, we place them directly on the injured skin. Or for example, when we use decongestants, we place them within the nostrils of the nose. For another example is using ocular drops when we want to target the eyes. And there are also organs that may be targeted without the drug necessarily reaching the systemic circulation. And they have a few examples here, like the vagina. We could include the ears, the urethra, or even a joint, in which case we would call it an intra-articular route. As you can see, some drugs may be given by inhalation if we target specifically the airways. And a good example of this would be the bronchodilators or some steroids like fluticasone. Parenteral administration of drugs can be further divided into specific routes based upon which place the needle is introduced. As it shows in this picture, parenteral administration is typically performed by injection using a needle and a syringe. And as you can see, the angle of the needle insertion is different depending on which location you would like to place that drug. For example, it's usually perpendicular to the skin if we want to target the muscle. The prefix intra means within, so an intramuscular administered medication is put within the muscles. Subcutaneous injections are administered beneath the skin, but not so deep as to be injected in the underlying muscle. whereas if you put it within the skin, that needle usually has to be almost parallel to the skin. Intradermal route is usually reserved for skin testing procedures, for example, testing for tuberculosis or a reaction to an allergenic substance. And not included here on this graph, but which would be another parenteral route, is the intraperitoneal injection. In this situation, the drug is put into the abdominal cavity, and it's frequently used when either the IV or the IM injections are not practical, and I'm thinking of some small laboratory animals, or we can also use it to infuse large volumes of a solution that may not be easily delivered by any other route. The reasons for using a parenteral route include drugs which have poor or low oral bioavailability. Also, patients that are unable to take the drug by mouth. For example, when that drug may result in irritation of the GI tract. We also use parenteral route when we need to have an immediate effect, usually in emergency situations, or also when we desire to control the rate of absorption and the duration of the effect. Now, because each route of administration can also be affected by disease in different ways, the veterinarian must know these patterns in order to identify potential problems with a route of administration and take the appropriate measures to compensate for any problems that may come. For example, I'm thinking of scouring a baby calf, which is dehydrated beyond 8%. And in this situation, he should receive fluids by IV route and not by subcutaneous or orally. And unless you give them IV, if you give them by any other route, it will result in very slow absorption because the animal is dehydrated. And also the delivery may not be fast enough to save the animal. On this other slide, we have a table with the pros and cons of the different routes of drug administration. Intravenous administration means the drug is injected directly into a vein. This can be given as a single large volume at one time, in which case it's called an IV bolus. Or it could be slowly injected or dripped, if you like, into a vein over minutes or even hours, in which case we call it a constant rate of infusion. And with this mechanism, we usually reach a steady accumulation of the drug until some point that the drug concentrations are on a steady state or a plateau, if you like. And basically they remain there until the infusion is stopped. An IV bolus would be like dumping all the required water into an empty bucket all at the same time. And an IV infusion would be like dribbling water into a bucket, usually at a faster rate than it leaks out of that bucket. The intravenous route can also be used to safely administer drugs that can be very irritating or painful if they were injected into a muscle or beneath the skin. And in this situation, the accidental injection of an IV administered drug outside of the blood vessel would be called an extravascular or perivascular injection because it's outside or around the blood vessel. And some drugs that are injected extravascularly can cause extreme tissue inflammation and tissue necrosis. So you may want to exercise caution in these situations. Not included here would be an intra-arterial injection in which places the drug directly into a blood vessel, like the IV route of administration. However, intra-arterial administration can produce effects that are very different from the effects of the same drug if it had been given intravenously. Drugs that are given by the intra-arterial route are injected into an artery, not a vein, and consequently the blood that carries the injected drug away from the heart and towards a specific tissue or organ. By contrast, if we inject a drug into intravenous splash, it's going to be carried away from the tissues towards the heart. In the heart, it's going to be diluted by the venous returning from all over the body. And by the time the IV passes through the heart, the lungs, and then returns to the tissues, it's being well mixed and diluted in all the blood compartment. So because an intraarterial injection results in all the drug being delivered at high concentrations directly into tissues supplied by that artery, the tissues supplied would definitely receive concentrations that would far exceed the normal therapeutic range, and they can produce a local toxicosis. By contrast, there are some drugs that would benefit from using in an artery instead of a vein, and I'm thinking of some antineoplastic drugs to treat a localized cancer. Now, if I mention some of the advantages of the intramuscular and subcutaneous routes, we should say that they usually result in good absorption. That may be really rapid or slow depending on the type of formulation. The good thing about the slow release formulations is that they can have very long duration of action of even weeks. That would be impossible to achieve with any other routes. And if we were to mention some examples, we could talk about the insoluble esters of corticosteroids that may last several weeks, as opposed to the rapidly soluble esters that may last just a couple of days at the most. Because the muscle is better perfused than the subcutaneous tissue, the absorption is typically faster by intramuscular compared to subcutaneous. And drugs that are meant to be administered IM should probably not be given subcutaneously or vice versa. A drug that is intended to be IM may not be absorbed if it's given subcutaneously, and if it did, they would probably not attain therapeutic levels, and their excretion would be extremely long, which may cause residues in case of food-producing animals. Now, a disadvantage of the intramuscular and subcutaneous route is that the injections usually hurt. They are painful, and they may cause localized inflammatory reactions. And also with the IM injections, there is always the risk of causing nerve damage if you accidentally hit some nerve. And I recall a case in which I injected a very charming and playful Saint Bernard in the hind leg, and I definitely hit that femoral nerve and left that animal permanently lame and on that limb. And in the end, unfortunately, I had to put it down. Now, if we talk about some of the advantages of the oral route, we first need to say that together with the topical route, they are the easiest to perform and is usually preferred by most patients. The drugs don't need to be sterile to be administered, and depending on the type of preparations, the absorption can be either very rapid within minutes, or it may be extended several hours for slow release preparations. With these slow release preparations, usually the drugs are formulated in such a way that they are protected from the action of the stomach enzymes and acid. And some of the disadvantages pertain to the unpredictable absorption, particularly when we give drugs with food. Food may bind the drug, and if the animal, for example, were to have diarrhea, it may not stay long enough to be absorbed. And there is what we call also the first pass effect by the intestines and the liver, which may degrade the drug before it reaches the systemic circulation. So as you probably all know, also with some cats, the oral route is not easy, and it can be just a nightmare sometimes. And with regards to the topical application, this is when the drugs are applied directly to the surface of the skin. For example, when we use lotions or creams. It's obviously a very easy and non-invasive method, which results in high level of patient satisfaction. The problem is that most drugs tend to have a molecular weight and a solubility that prevents the absorption through the skin. Having said this, I must say that these have been largely overcome with technology and some solvents that enhance penetration. And I can think of many antiparasitic drugs like the ivermectins that are formulated topically, and they're used for both internal and external parasites. Nowadays we have a lot of spot-on formulations, particularly for small animal practice, to control parasites. And finally, with regards to the inhaled medications, this is also called aerosol administration, meaning air or gas solution. In other words, the drug is administered in an inhaled mist or gas, and is absorbed within the lungs, airways. And in the case of gas anesthetics, or maybe they may simply remain in the airways in cases of bronchodilators. And the advantages are obvious in the case of gas anesthetics, because you can control the rate of anesthesia on a minute-to-minute basis. And when the target site is within the lungs, the amount of drug that needs to be given is obviously going to be much lower than if we were to use any other systemic route. And one of the disadvantages of these routes is that you may need a very good inhaling technique to be effective. And in the case of bronchodilators or steroids, the particle size needs to be really small to reach the smaller airways. So if we put a time frame in which we would expect the action of the drug to start taking place, it's obviously going to depend on how quickly it reaches the target site. As you can see, with the IV, is usually the fastest. In small animals and birds, it may be hard to find a vein, so we use the intraosseous route, which is just as fast. This is followed by the endotracheal and inhalation routes. That actions take place within minutes. And as you can see, with the IM and the subcutaneous routes, we are talking about 10 to 30 minutes. This would obviously apply for rapidly absorbed formulations, not the deposit ones. And ingestion may take anywhere from 30 to 90 minutes. This is largely going to depend on how long the drug stays in the stomach before it moves to the intestines. And if we give a drug with water on an empty stomach, usually the absorption may be much faster, just within a matter of a few minutes, and also more complete, as opposed to when we give it with food. Food is going to remain in the stomach for several hours, and the presence of food may also prevent much of the absorption from taking place. And finally, we have the transdermal, which can be very variable between minutes to hours. So if we were to summarize everything we just said, the choice of which route we're going to use is going to depend on, to begin with, the physical characteristics of the drug. We have not really alluded much on this presentation on this aspect. The speed at which the drug is absorbed or released from its formulation. Also, the need to bypass hepatic metabolism. Also, the need to achieve high concentrations at particular sites. How accurate we may want to be. And finally, the condition of the patient is always something that may alter whether we use one route or another.